Hi there, I'm Dr. Gary Simmons from Carilion Clinic Neurosurgery, and I want to talk to you today about acoustic neuromas. What the heck is that? Well, acoustic neuromas is a type of brain tumor that we see with some frequency. This is a benign tumor, meaning it is not a cancer, it does not spread elsewhere, but it can be deadly. Now, how does that work? Well, any growth inside the head that gets big enough will eventually crush the brain enough to cause coma and then death. And acoustic neuromas can certainly do this, but it takes years to reach that level. Acoustic neuromas grow off a very small nerve that accompanies your hearing nerve in the back part of your brain, way back here. And it can affect your hearing. As a matter of fact, it tends to affect hearing earliest, and you may not notice it. Most often we pick it up when people get formal hearing testing and we get notified that somebody has something called a sensory neural hearing loss. And if somebody has that on routine hearing screening, they often will get an MRI and a growth may be seen on this nerve, what's called cranial nerve 8. Often these can be very small, but they grow slowly and the brain can mold around it and they can reach tremendous sizes, even as big as my fist, all in an area where it's no good to be that big. And they will crush the brainstem and eventually shut the brainstem down. So they need to be treated if they are growing. Turns out that a lot will sit there like a bump on a log and not necessarily grow. And therefore, if we discover a small one and there aren't major problems related to it, we'll watch it. If they are causing major problems, or they're big, or they're defined as growing, then we want to do something about it. It turns out that there is more than one option, however, in what to do about it. They can be treated by surgery, which means to go into the head and physically remove the tumor, or they can be treated by something called stereotactic radiation. That is a type of radiation treatment that focuses small beams of radiation into one area, and where the beams cross, that area gets tremendous radiation, but every other area around it gets very low radiation. It's a very high technical, special type of radiation. And that has been pretty darn effective on acoustic neuromas, particularly smaller acoustic neuromas. So surgery and stereotactic radiation, or sometimes both, are what's in our armamentarium of treatment for acoustic neuromas when we've decided that they need treatment. But remember, quite a few only need to be watched. An MRI a year or an MRI every couple of years if they're not growing and not causing problems. We'll talk more about the surgeries and treatments in a future session. Thank you. Bye-bye now.